Hey guys, let's talk about everyone's favorite topic, acid-base imbalances. So I'm going to start by talking about what acid-base imbalances are, just the basics. I'm going to talk through the four main acid-base imbalances, and then I'll get to actually, we'll do a couple real quick practice, acid-base, figuring out, breaking down a acid-base problem or figuring out an ABG. So let's get started. So why do we have to study all this crap? So we study acid base because having an acid base balance or having a normal pH is really important to the body. Your body only works well the way it's supposed to when there's a balance there, and it's a very fine balance. So, like, there's some examples, like when things are out of balance, things that normally the bacteria is good, it can become pathogenic or become a problem. Normally, your oxygenation, things are going well, then things can start getting worse. Things that were once helpful become destructive, and some organs even stop functioning. So just know your body is like meant to operate a certain way. And if you want to think of this simply, think of, like, for example, like in your stomach, you're supposed to keep a certain pH or acidity in your stomach in order to digest food properly. So when things get off with that, it doesn't function the way that it's supposed to. So we're not going to get too deep into this. You do not need to memorize this thing over here to the right, but just understand that there's multiple players here. So like if something gets off with my pH balance, the first thing to act is usually going to be my cells. They can move hydrogen ion in and out of the cell to balance the acidity. They do this super fast. The lungs are the next quickest thing that can jump in and help when there's an acid-base problem. So they do this by increasing or decreasing the respiratory rate. Effectively, I blow out CO2. So think of it same the way the cells move hydrogen in and out of the cells. The lungs can move CO2 in and out. Well, I don't say in, but they can choose how much CO2 they're letting out or how fast I'm breathing. So because CO2 is an acid, so the faster I'm breathing, the more acid I'm getting off. The slower I'm breathing, the less acid I'm getting out. They can work pretty quickly when there's a problem. The last guy to help is going to be the kidneys. Now, it has this thing called bicarb. So far we've talked about hydrogen ion. It's an acid. CO2, it's an acid. Then there's HCO3, which is a base, or what do you call it? I think of like a buffer, and it helps to make it where there's not so much acid. It buffers acid. So the kidneys can secrete more of this if there's too much acid, but they do this a lot slower. So these are my players in the acid-base balance, the main ones. So how do we even know someone is out of balance? The main test that you're going to see used, the one that you're going to get very annoyed with, is going to be the ABG. So there's four main parts to the ABG, and we're going to break down each part. First, there's the pH, and again, we're going to go into each of these. There's the PO2 or O2 saturation. The PaO2 is mostly what we go by here. Then there's the PaCO2. So in PA and PaO2, PaCO2 is just the partial pressure. And then there's HCO3 or bicarbonate as well. So these are the numbers we need to know, and here's the normal values for them. But we're going to go through each one. So first there's pH, and this is the one that's most important, the one that I most worry about being within normal range. I like it from 7.35 to 7.45. This tells me the balance of acid within my body overall. So even if my CO2 is a little off, my bicarbonate's a little off, if my pH is still in balance, I can usually make my body's doing okay. It's keeping things in balance. So it's as a whole, like, this is one of the best measures of where I'm at, because sometimes the other numbers can get a little off, but as long as my pH is staying where it needs to be, I can usually be okay. Minor alterations can make a major change. And like I said, this is that number that I'd be most focused on. So you might see a doctor, you might see an ABG, and you're like, oh my God, my CO2 is this. But the doctor's going to say, what's your pH? Is the pH normal? Because that really shows that your body is able to compensate and get back to where it needs to be. We also look at oxygenation. So this is definitely helpful for some of the lower respiratory disorders that we just talked about. There's something called PaO2, and then there's also SaO2. So most of you guys, when you think oxygenation, you're thinking SaO2 or SpO2. This is telling how much is delivered to my tissue. So this is like the finger probe that people have on. This is telling how much oxygen is getting from my arterial system and then going through my venous system all the way to my peripheral tissues and getting delivered. It's saying how much is getting dropped off. And this is a great measure of how well a person's oxygenating, because if my little fingers and toes are getting oxygenated, that's great. It's also a measure of how much oxygen is bound to hemoglobin. So it tells me about like status if I'm having issues with supply and demand with oxygenation. So this is all about delivery. This is the SaO2, SpO2. Now, this is not something that shows up on an ABG. This is something that, again, I get with a finger probe that I can measure non-invasively. But if we get a blood gas, then remember that's an arterial blood gas. We are checking, that's what a PO2 is. So when I get a blood draw usually from the radial artery for an ABG, what I'm getting there is the amount of oxygen that is in my storage in my artery. In other words, think of this as how much that is available. And so effectively my PaO2 is like, this is how much supply that I have in general for of oxygenation. This is the supply of oxygen I have, whereas the SpO2 or SaO2, that's how much it's actually getting from the supply and getting delivered. There can be a difference there. So the analogy I always like to do is think of like an Amazon store. So an Amazon store keeps a bunch of supplies at a main store. So think of the PaO2 as this is how much supply of something that I have. That's the PaO2. But then how much of that actually ends up getting delivered to people, et cetera. So, so the important point here, don't get too confused with this, is just recognizing the PaO2, the normal is different. The normal is 80 to 100, whereas the SpO2, we like 95 to 100. But it's the difference between the PaO2, this is how much supply I have in the first place, and then the SpO2 is how much that's actually getting from the supply to my tissues, because there's other things that could block it. Even if I have enough oxygen, there's other things that could be blocking it from getting delivered. But keep in mind this is that we really like knowing what a PaO2 is on the gas, because in order to be able to deliver any, I have to have a supply. So it tells me, what am I starting with, or what is my beginning amount of oxygen that I have available to even get delivered. The higher that you have for your PaO2, the more that can go to bind with hemoglobin and then get to your tissues. So you need to have a storage, or think of it like a supply. You need to have a supply in order to get to the other tissues. PCO2, so this is your carbon dioxide, and here's the normals and everything here. This is the waste product that, in our alveoli, oxygen goes in, CO2 goes out. This is how I release acid from my body. I know it's a waste product I need to get rid of, but it also can be used with acid-base balance to get rid of more acid if I'm overwhelmed with acid. And also tells me a lot about how a patient is ventilating. Then there's HCO3, which is bicarbonate. It's a base. Like I mentioned, here's your normal here. It is a slow buffer. It decreases acid from my body slowly over time. So it's not going to be an overnight quick where all of a sudden I'm back into balance because my kidneys came to the rescue, because this is something the kidneys secrete. So remember with the PCO2, that's the lungs that are getting rid of this, where here the kidneys that work a little bit slower, these are my turtles, they're going to help buffer and help that pH to get back to normal, but they're going to do it slowly. If I'm too acidic, they will secrete more bicarbonate. If I'm too basic, they will decrease the amount of bicarbonate that I am secreting. So let's get into these different acid-base imbalances. And these pictures are not mine. There's a wonderful company that does these. I highly recommend their products. They make great little books. So they're super helpful for nursing, but this might give you an idea. Now, you'll notice here, there's a lot of symptoms here. Now, for my school, my class, you do not need to go in depth into these symptoms, because I'll tell you, a lot of them are the same. They're very similar. They're very general symptoms. I want to tell you what to focus on. You do need to know what this patient's going to look like, but more general versus like the hyperreflexia, muscle weakness. Those are really generic symptoms versus like, what is a patient going to look like? So if they're in respiratory acidosis, we're either holding on to too much acid or losing too much base. But most of the time, the problem here is they're holding on to too much acid, and they're holding on to too much acid usually because they're in a state of hypoventilation, where I'm not taking a lot of deep breaths. It might also be known as bradypnea, where I'm probably breathing less than 12 breaths per minute, or even if I am breathing enough, maybe I'm not getting the CO2 or the acid out. I am retaining the CO2. This happens commonly in patients that have decreased level of consciousness or have some sort of lung problem like infection. So what we want you to know, at least for my school, we want you to know is who would be at risk for this acid-base imbalance? What is the ABG going to look like for this patient? And what's the general treatment for it? So for respiratory acidosis, again, these are people with lung disease. So COPD, pneumonia, pulmonary embolism, things like that. Anyone who's respiratory depressed, again, they're low respiration. So someone who maybe had a head injury, someone who is overdosing on something, they're going to be more at risk for this. Their ABG is going to look, it's going to have a low pH because it's acidosis. Their CO2 is going to be elevated. Those are the two things you want to look at. I don't know what their bicarbonate is going to be. It depends on if they're compensating or not. So just think of those two, and you can see them here. That's what I love about this company that makes these. They really put it straight up right here. pH is low, CO2 is high. And you can see with respiratory problems, when the pH is low, the CO2 goes opposite in the opposite direction. So something to note for when we work on stuff later. Treatment, I need to treat the cause. So if the problem is they're not taking enough breaths, I need them to breathe more. So if it's, let's say they overdosed on a drug, I need to reverse that drug. If they are, they have COPD, I'm going to teach them pursed lip breathing. If it's infection, I need to treat the infection or get to the bottom of the issue and allow for better ventilation. I want them to take deeper or more breaths as needed. Again, it depends on the cause. So always look in your question to see what the cause is, because like for a COPD patient, I don't need them to take deeper breaths. I need them to exhale more. But for other patients, it just kind of depends. But the big picture here is I need them to ventilate. I need them to breathe more or exhale better as a whole. On the other end of the spectrum, there's respiratory alkalosis. And this patient looks like the opposite. So again, if it's alkalosis, if it's acidosis, they're holding on to acid. If it's alkalosis, they're losing acid or they have too much bicarbonate. In this case, they have they're losing too much acid, and they're losing it through their lungs because they're breathing too fast. So think of a very anxious patient. This is like the nursing, right before a nursing school exam, how you guys feel. You're very, very hyperactive. You're hyperventilating, breathing fast, kypnic. Your respiratory rate is elevated. So all that acid, you're blowing it out. So they might be anxious, irritable, emotional. It also can happen in things like asthma as well, or any sort of fear. So their ABG is going to look similar in that it's opposite, except this time the pH is up. So remember, respiratory acidosis, pH was down, CO2 is up. Now, alkalosis, pH is up, so therefore CO2 is down. So remember, we're always going in the opposite directions with pH and CO2 when we have a respiratory problem. So how are we going to fix this? So if it's an asthma attack, we obviously need to fix this. They're breathing fast because they can't breathe. So we need to give them their treatments and stuff for that. But a lot of these patients, it's therapeutic communication is your first intervention. Now, you're not going to like that. It doesn't seem like that should be the first intervention, but it is the best thing for these patients. Calm, support them. And as a last resort, things like anti-anxiety medications can definitely make a big difference. But again, that's only if the last resort. We always do least invasive first. Now let's talk about the metabolic problems. So there's metabolic acidosis. So when we start talking about metabolic problems, we're usually talking about problems with the GI system or problems with the kidneys. So usually there's something wrong with the fluid balance, et cetera. So remember, with acidosis, we learned with respiratory acidosis that they're either holding on to too much acid or losing too much base. And so the same goes for this, is that we can be holding on to too much acid, and we're holding on to acid maybe because we're diabetic and we're in diabetic ketoacidosis. It also could be someone who's in kidney failure, because if your kidneys aren't working, you're going to hold on to more acid or not be able to regulate the same way because your kidneys aren't doing the same stuff with bicarbonate. Another cause could possibly be if you're pooping a lot. We vomit acid, we poop base. So if I'm pooping a whole lot, I'm losing that base. And so therefore all I'm left with is acid. know that because the kidneys take longer, when you have kidney problems, any metabolic problem, the lungs are going to come in and help. So you should expect for a patient that's in more severe metabolic acidosis, especially think DKA. So connect this with DKA. DKA, they're going to be in metabolic acidosis, and their lungs, remember, the lungs can come in and help super fast. They're going to come in and compensate with hyperventilation. So you see this patient, it's a metabolic problem, but you're like, why are they breathing like that? They're actually trying to compensate. So DKA, these patients, you're going to note with them that they're in the state of metabolic acidosis, but you're going to see the, it took me a while to take my own breath. It's like it's a rapid, deep breathing. And I'm going to put myself out of breath and pass out in this video probably from doing that. Kussmaul, it's called Kussmaul's breathing. But it's rapid, deep ventilations, and it's your body's compensation for metabolic acidosis. So don't get it wrong. So like you see that in the symptoms, there's a lung issue. It's not a lung acid-base imbalance. It's the compensation. So we'll talk about that more with when the actual ABGs, but you always want to look for what's the actual imbalance first. So if you had an ABG, and then if they're hyperventilating, maybe they're not in respiratory alkalosis, maybe they're just compensating for a metabolic problem. So we need to treat the problem. If it's kidney problem, we need to be kind to the kidneys, maybe give fluids if they need the fluids. DKA, we need to treat it with insulin and fluids. They may need extra bicarbonate to, because if their kidneys aren't working, we need to buffer the kidneys. Last but not least, there's metabolic alkalosis. So this patient is going to be dry and empty. And what I mean by that is, again, we talk about for respiratory alkalosis, they're losing all their acid because they're breathing it out. Well, for these patients, they're losing their acid, but in a different way. Most of these patients are losing their acid because they're vomiting too much, or they have an NG tube. We're suctioning out too much of the acid from their stomach, or they could be taking antacids. In other words, we're taking away too much of their acid, or they're gaining too much base. 9 times out of 10, it's usually a GI issue with these patients that we're suctioning them too much, they're vomiting, or they're taking antacids. And so on the opposite end of the spectrum, now I have never seen compensatory hypoventilation, but it definitely can happen. So naturally your body, if you're in a state of metabolic alkalosis, just like with Kussmaul's for the rapid and deep breathing for metabolic acid, I'm going to be able to talk. Kussmaul's respirations for metabolic acidosis, you can have hypoventilation for metabolic alkalosis. In other words, your body recognizes that you need more acid, you're losing acid. So if I breathe less, I'm holding on to more CO2, which means I have more acid. So this can be caused, again, by loss of fluid or acid. And remember, we vomit acid, we poop base. So if I'm losing acid, their ABG, and I don't know if I talked about it for this last one too, by the way, their ABG. So for metabolic problems, backing up, for metabolic problems, the arrows go in the same direction. So if I have a low pH, then my HCO3 is going to be low too. Remember, in respiratory, they go opposite. In metabolic, they go in the same direction. So if I have a low pH in a metabolic problem, I look at my HCO3. If I look at my let me back up. If my pH is low, and then I look at my HCO3 and it's low too, then that's going to be a sign I have a metabolic problem because they're going in the same direction. Make more sense when we talk about the actual ABGs. But here you can see here, my pH is high because I'm in a state of alkalosis. And then because of that also, my bicarbonate is high as well. So they're going in the same direction. So we want to treat the cause. If they're vomiting, give antiemetics, stop suctioning them so much, and then stop any medications that might be leaching away their acid. So if that seemed like the hard part, most people find this part a little bit harder. So you need to find a way that works for you. If you do not find the Rome method helpful, you can stop this video right now and go watch a tic-tac-toe video and learn how to do that. I find the Rome method in making arrows so much more helpful for me. So that's the way that I teach it, but feel free to scroll along or, check out some other videos because there's a ton of great stuff out there. So we're going to move into and make some, different choices here. Hold on one second. Sorry about that. We're going to do some practice problems together. So I have upcoming things that talk about how to do this, but we're going to work through some of these together. So if you want to take a picture of this or look at this, I'm going to go to my whiteboard and I'm going to work out some of these problems. But effectively, I'm going to kind of show you my systematic method. Now, I have a lot more videos about this. I have ones where we do practice together. I have ones where we do these step by step. So feel free to go check those out. But this is just a part of my lecture. So let me go to my whiteboard here and hopefully see if I can share this here. It's too big now. How do I make it smaller? Well, I guess this will work. I'll just have to move it over. Okay. So here's our first problem here. And I guess I can, hopefully that you guys can see this here. Let's see if I can, okay, that's better. So it's still a little big, but it's all good. It's all good. All right, I'm gonna just have to give up. That's not gonna be perfect size. Maybe I can do this. There we go, that's better. Much better. All right, maybe I'll move this over here like this too, so we can still read. So our first step when we're looking at a blood gas is to make arrows. So I want to know what's normal and not. So I come in here, my pH over here, it's low. So I'm going to make it, in my handwriting is horrible, so it's low. My CO2 here is high. And then my HCO3 here, it's normal. So I'm going to put it here like this. So first I make arrows, then I compare my arrows. I usually compare my pH and my CO2 together because they're just next to each other. So it's easier. So I want to see if they're going in the same direction or opposite directions. So like these directions say, if it's the same direction, I have a metabolic problem. If it's different directions, I have a respiratory problem. So I'm looking at this arrow, and they are going in different directions. So since they're going in different directions, and by the way, I like to make my little thing here where I name my thing. So they're going in, here, let me see. Okay, yeah. First, let me do this before I get too far ahead of myself. So first, I look at my pH. Let me back up. So first step is I look at my pH. Am I in a state of acidosis or alkalosis? I am low. So since my pH is low, I'm in a state of acidosis. If this is less than 7.35, I'm in a state of acidosis. If it's greater than 7.45, I'm in a state of alkalosis. So the next step, like I said, is I make my arrows and see what is normal or abnormal and compare my pH and my CO2. These are going in opposite directions, so I have a respiratory problem. So most of the time, students can usually work out these first two parts, but then they get really stuck with the compensation. So for compensation, effectively what we're looking at for is I'm trying to see, remember how I said like with my kidneys, my lungs will come and help. Well, with my lungs, my kidneys can come and help. So effectively I'm looking is, are my kidneys starting to try to help? So right now I'm looking at this HCO3 is 26. That's normal, which means my kidneys have not come to the rescue yet. If this number was abnormal, I would have some compensation, but right now this number is normal. And I'll explain more about compensation in a little bit with some of these other problems. So I have uncompensated respiratory, I can't fit this whole thing in, but you get it. Uncompensated respiratory acidosis. So that's this one. So let's do another one. And this one's a little different in the, I was like, let's see, am I under draw? No, I'm still under text. How to get draw? Okay, like this. All right, let's see. So I've got this. So remember, step one, I make my arrows. So this is high. This is high. And this is high. So then I look at my pH. So step one, I make my arrow. So make my lines, I make my arrows, and then I'm looking at my pH. And I want to see if it's high, low, or normal. So it's high, so I have a state of alkalosis. So I have a, what do you call it, an alkalotic problem. Then I'm going to start comparing my arrows. So I'm going to take my arrows and I'm going to compare this one to this one. Because they're closer and they're next to each other. They're going in the same direction. Boo, that means it can't be a respiratory problem. It needs to be it's going to be a metabolic problem. And I can even look over here. Let me look at this arrow. Remember, we have a metabolic problem. It's going to go in the same direction as my pH. So my pH and my HCO3 are going in the same direction. So therefore, I have a metabolic problem. So now I got to figure out this compensation issue. So remember, if I have a metabolic problem, so I have an HCO3 or bicarb problem, I need to look at my CO2 and see what it's doing. What are my lungs doing to help? So right now, my lungs are actually they're abnormal. See, there's an arrow here. If there's an arrow here, if there's not like a, hey, it's normal, what I am is what we call partially uncompensated, which means I'm not back. My pH is still abnormal. I'm not fixed yet, but my lungs are starting to try to come in and help and to get me back to normal. So that's the basics of like solving a basic ABG, but let's go to the next one. And of course, my whiteboard disappeared. There we go. Whiteboard, there we go. All right, so here's some frequently asked questions. Let me get this out of the way. Some frequently asked questions. They're like, what if my pH is normal? So let's do a problem where my pH is normal. So let's look at this one. So we get my let me get my stop. Life is falling apart. 1, 2, 3. So I'm going to get my arrows. This is normal, this is normal, and this is normal. So, what's going on here? Wait, if everything is normal, what do I have? A normal ABG. So there's nothing to solve here because this is just a normal ABG. I know. And just as a hint for those that are at my school, we very rarely would ever have you have a normal ABG on an exam because we like you to figure out abnormal versus normal. Okay, so let's say that everything is not normal. So like because a lot of people ask, well, what happens if my pH is normal? So sometimes if your pH is normal, if your pH is normal, but your other numbers are abnormal, it's a different problem. So some people say this is like, they're with me when we do these first problems and they're like, okay, yeah, that makes sense. But then it's some of these other problems. So let's do this one that might be a little bit more confusing. So let's get my lines out here. I'm going to make my arrows. My pH is normal. My CO2 is high. And then my HCO3 is high as well. So, the thing that people find confusing is like, well, how do you know if it's acidosis or alkalosis because your pH is normal? So this is what you want to do. If your pH is normal, but your other numbers are abnormal, like there's arrows, etc., what you want to do is you want to look here and say, okay, my pH is normal, but which direction is it closest to? So like, for example, like you can see here, I give you a little cheat sheet here. If it's less than 7.4, it's more acidic and it's going to have a down arrow. So that's for me. So even though this is normal, I'm going to pretend like, I'm going to not pretend, I'm going to see what is it closer to? Because even though it's normal now, what direction is it closest to? What did it just come from? So it looks like I was recently really acidic. So I'm going to put a down arrow and then I'm going to go through the same process. I'm going to compare and contrast. So because this is closer to being acidic than it is alkalotic, I most likely have a state of acidosis. Acidosis, I can spell. And then I'm comparing my arrows and look, I have opposite for respiratory. So I have a respiratory problem. So then here, the one thing to consider is if I have an ABG where the pH is normal, we call it, the compensation is always going to go from it's not uncompensated, it's not partially compensated, it is fully, I guess I should wear out the whole word, fully compensated. So here you go. And I'm going to talk more about compensation in a second if you're very lost. So it's fully compensated. Other things that people have trouble with is what if my CO2 is normal? So let's do this as a problem. If my CO2 is normal, it's usually a sign that's a metabolic problem, but how do we get through this problem? Because some people are like, oh, you told me to compare my pH with my CO2. And like I said, you can always compare your pH to your HCO3 too. It doesn't have to be the CO2. I just use that because it's closer. But let's do this. So, all right, so my pH is low, my CO2 is normal, and my bicarb is low. So what I'm going to look for here is I'm going to first start by, I have a state of, my pH is low, so I have a state of acidosis. Then I'm going to have to do arrows. Now, again, usually I do arrows. So how do I compare a pH with something that doesn't have an arrow? So what I can do then is I can compare this to my HCO3. And what direction? They're going in the same direction. So remember, metabolic goes in this, arrows go in the same direction. So I have a metabolic problem. And then again, we go back to my CO2 is normal. So my lungs are not helping yet to compensate for this acidosis. So I'm in a state of uncompensated metabolic acidosis. So there we go. So that's that one. So I know I went through that fast, but hopefully this starts to make sense. Again, I would start with some of the other videos I have if you really struggle with this, or again, if there's another method. Now, if you're looking at this and you're like, her way is really complicated, watch my other videos because I think that I explain it probably better in those, but I just want to get you a basics on some of the things that might come up. So figuring out compensation is the most confusing thing. So think of it this way, because some people are trying to understand what compensation means. Compensation, uncompensated means my kidneys or lungs have not even started to help yet. So with pH balance, remember, we care most about the pH getting back to normal. And the lungs and the kidneys help each other out. If there's a kidney problem or an HCO3 problem, the lungs come and help. If there's a lung problem or a CO2 problem, the kidneys come and compensate. So if something's uncompensated, I'm going to have an abnormal pH, an abnormal CO2 or HCO3, but the other one's going to be normal. So either my HCO3 or my PCO2, one of them is going to be normal, and which shows that it's not coming to help yet. Partial compensation means that they've started to help. So what you're going to see for this, look, if you do the arrow method, look, and if your pH is abnormal, your CO2 is abnormal, and your HCO3 is abnormal, it's always going to be partially compensated. So if you use the arrow method, that's why I think the arrow method is so much easier. You can visualize it. If everything is abnormal, if there's an arrow for every single one, then you have a partially compensated ABG. Then for fully compensated, what do you call it? Remember, the thing that's going to be different is your PCO2 and your HCO3 are going to most likely be abnormal, but your pH is going to be abnormal. So if you see a pH that is normal, but then your other two numbers are abnormal, that's a sign that you have a fully compensated. So to maybe visualize this, let me see if I can bring this back up. Let's see if I can drag this. Oh, it's down here. All right. So look at this. So we have something that's uncompensated. Just look at the arrows. For uncompensated abnormal pH, one of these two is normal. Over here, this is normal. This is abnormal. So for uncompensated, so same over here. We have abnormal pH, then an abnormal HCO3, but then one of my numbers is normal. So look at the arrows. If you have two arrows here, like a pH and HCO3, or a pH and a CO2 are abnormal, and then one of these numbers is normal, you're uncompensated. If you are, if you are partially compensated, look, you have arrows for every single one. Your pH is up, your CO2 is up, your HCO3 is up. And it doesn't matter if they're up or down, but just get the point that look at where there's an arrow for every single one. Every single one of these is abnormal. Whereas if you're fully compensated, we go over here, and I'm going to maybe try to, where's my eraser here? Take away this so it's not as to not, no, where's my undo button? Redo, undo. Okay. I was trying to take away this, but anyway, so if you look at this as a whole, the pH is normal, but both of your other numbers are abnormal. So you can just go by this, but effectively you just want to be looking to see if your other guy is helping. So if it's a metabolic problem, look at the CO2. Is it normal or abnormal? If it's a respiratory problem, look at the HCO3. I'm sorry, that's what's down here. I was covering it. So like I said, for metabolic, look to the CO2. If it's normal, if you have a metabolic disorder, or metabolic acid-base imbalance, and your CO2 is normal, it's uncompensated. If it's abnormal, it's either partially or fully compensated. So then you need to look at the pH. If the pH is abnormal, you are partially compensated. But if the pH is back to normal, you're fully compensated. So think of it this way. Fully compensated is really saying, even if my other numbers are off, I've gotten back to the point where my pH can still be balanced. In respiratory, it's the same, but just with the HCO3. So if I have a respiratory, like let's say acidosis, I'm going to look at the kidneys. If it's normal, the HCO3 is normal, or with like 22 to 26, I am uncompensated. But if it's abnormal, then I look to the pH. And if my pH is normal, I'm partially, if my pH is abnormal, I'm partially compensated. But once that pH is back to normal, fully compensated. So if you see a ABG that has a normal pH, and again, I said we usually do not have a normal ABG. Always double check, because I don't want to say never say never. But if the pH is normal and the other numbers are abnormal, you have a fully compensated ABG. Whereas if all the numbers are out of range, you have a partial compensation. If you have one number in there that's normal, but the others are abnormal, it sounds like an uncompensated ABG. So hopefully this helps you, these tricks help you, but what's really going to help you more than anything is practice. Here's a list of practice ones. Feel free to take a picture and do these. I love the ABG Ninja, and there's also Survive Nursing. You slash ABG, and you could Google these. They have great, like it's just like a continuous loop where you can do these over and over and over again. And for these particular ones, and you can do it like they give you different ones all the time. Here is the answers to those so that you can get some practice. The best thing to actually learn how to do ABGs is practice over and over. If you hit any hiccups, please let me know. Hopefully you find a method that works for you if my method does not work. So anyway, that is it for ABGs and acid-base balance. I hope this helped, and I am looking forward to seeing you soon for diabetes. See you later.